Welcome to the fifth of 8 webinars in the Project Firstline Infection Prevention Essentials webinar series. My name is Christina Boyd, Director of Quality, Safety, and Health Policy at the Illinois Health and Hospital Association, also known as IHA. As we are going through a handful of housekeeping items, we encourage you to please complete the poll that is open on the screen at this time. That can be found in the lower right-hand corner. Results from this poll will not be shared with participants on the line today and will only be seen by the presenters. After you have selected your answers to the poll, please be sure to click the Submit button to ensure that your answers are received. Before we begin, I do have a few announcements. Due to the large number of participants on the call today, everyone is on mute. We will have plenty of opportunities for comments and discussions throughout the session. So when you are ready to talk, you can go ahead and feel free to bring yourself off mute by clicking the unmute button at the bottom of your screen. If you are on the phone, it would be *6 to unmute your line. And then we do encourage you to utilize the chat box at the bottom right-hand side of the screen. Finally, I want to make you aware that this webinar will be recorded. By attending this webinar, you are considered to have consented to being recorded. If you do not want to be recorded, please exit the webinar now. Finally, a copy of the slides and the recording of the webinar will be shared with all registrants following today's presentation, as well as posted to the Chicago Department of Public Health Healthcare Associated Infection website. Again, I want to welcome you to the fifth of 8 webinars in the Project Firstline Infection Prevention Essentials webinar series. This series is intended for all frontline healthcare personnel, regardless of infection prevention training or educational background. These sessions will provide the foundational knowledge you will need to be able to confidently apply infection prevention and control protocols necessary to protect yourself, your facility, and your community. For this webinar series, we will be utilizing the educational materials from Project Firstline, which is the Centers for Disease Control and Prevention's collaborative aim to provide infection prevention training for frontline healthcare personnel. We appreciate all of the great work that you do to serve your patients and communities and are looking forward to connecting with you throughout the remainder of this webinar series. Today's session is accredited by the state of Illinois for up to 1 hour of nursing continuing education credit. Only those attending the live program are eligible for continuing education. Following today's webinar, you will receive a survey via email, and you will need to complete all of the fields in that survey, including entering your nurse license number. And you will need to do that by Tuesday, May 24th, in order to receive your continuing education credits. If there are multiple people in the room with you today, please make sure that you forward that survey link to your colleagues so that they can always also complete the survey and get their continuing education. Within 2 to 4 weeks following the close of the survey, respondents will receive their continuing education certificates from IHA staff. All participants in today's webinar will receive a certificate of attendance. The Illinois Health and Hospital Association is partnering with the Chicago Department of Public Health to host this series to support your infection prevention training needs. We are also joined by Crystal Bayer, who is an infection preventionist at Advocate Sherman Hospital and has extensive infection prevention experience and is enthusiastic about educating peers around infection prevention topics. You will be hearing from these team members throughout the webinar series. The Centers for Disease Control and Prevention Project Firstline initiative aims to provide infection prevention and control training for frontline healthcare workers by supporting their efforts to understand and confidently apply the infection prevention and control principles necessary to protect themselves, their facility, and their community from infectious disease threats. There are multiple components of this initiative, and the project goals include: first, to conduct an infection prevention needs assessment of frontline healthcare workers in the city of Chicago in an effort to identify training gaps and needs. Second, to promote awareness of the CDC Project Firstline infection prevention training curriculum and to facilitate foundational infection prevention training for frontline healthcare workers using that CDC framework. And now we know that many of you on the line today are seasoned infection preventionists or have had previous infection prevention training. And you will no doubt find the content throughout these educational sessions to be basic and truly geared towards building those foundational components for healthcare workers. There will be opportunities for discussion during each one of our webinar sessions to hear about participants' experiences and to learn from peers. We would welcome those with experience in infection control to share their knowledge and serve as mentors to those that are in the early stages of learning about infection prevention practices. And then finally, our third goal is to evaluate these training sessions to ensure that they provide meaningful opportunities for frontline healthcare workers. With that, we'll go ahead and start today's discussion about how viruses, including COVID-19, are spread. This slide highlights today's learning objective. By the end of today's session, you will be able to identify the ways that SARS-CoV-2, the virus that causes COVID-19, is spread. Okay, we are going to start out with a video today. As part of the Project Firstline curriculum, we will be playing a video from Dr. Abby Carlson, an infectious disease physician at the Centers for Disease Control and Prevention, who talks about the spread of virus in greater detail. We are required to play these videos, and we are committed to making sure that everyone on the line are able to clearly hear the videos that we are going to play today. So as a reminder, the video sound is going to come through your computer speakers, regardless of whether you're called in on the phone or not. So in order to make that happen, participants that are dialed in on the phone, you will need to turn the volume down on your phone, and you'll need to make sure, actually everyone needs to make sure that their computer speakers are turned all the way up or, loud, not all the way down, and unmuted. Same thing if you're wearing a headset. Please be sure that the volume on your headset is turned up and that your headset is not muted. In the event that you are unable to hear the video, or if your computer does not have speakers that the video can play through, we are going to be posting a link to the video in the chat box, and you can watch that on another device. Also, we will be putting a summary of the video into the chat. The videos will also be sent out in follow-up from today's webinar, so you might have to watch it later, but no worries, that summary will be there for you in the chat. So I'm going to give you a second to get your speakers turned up and make sure that they are not on mute, and then I will play that video. Okay, hopefully nobody had any issues hearing that video. But Dr. Carlson did share a lot of information during the video, and some of the key takeaways include understanding that viruses spread in a variety of ways, especially on your hands. When you touch something that has a live virus on it, and then you touch your face without cleaning your hands first, you can introduce the virus to your eyes, your nose, and your mouth, as Dr. Carlson explained. Respiratory droplets come in a variety of different sizes, and when they're breathed out, some will be caught in the air and carried away, but others are big enough to fall onto nearby surfaces like patient beds, waiting room chairs, desks, and even clothing. Once the droplets land on something, the virus can survive long enough for you to touch that surface and for the virus to make it onto your hands. From there, the virus gets into your body if you touch your face without cleaning your hands first. Like Dr. Carlson said, it is one of those habits that is really hard to recognize and even harder to break. We can see why good hand hygiene and good cleaning of the environment are so important for infection control. Okay, so we are going to move into another video. Again, as part of the Project Firstline curriculum, we will hear again from Dr. Abby Carlson, who's going to share a little bit more about COVID-19 and how it spreads. We are required to play these videos and again are committed to helping you hear them. So for those of you who might have jumped on the webinar within the last couple minutes, in order to hear those videos, they are going to be coming out of your computer regardless of whether you've used your phone to call into the webinar today. So in order to make that happen, we do need to turn the volumes on our phone down and make sure that our computer speakers are not muted and the volume on the computer is all the way turned up. Same deal if you're wearing a headset, turn that volume up, make sure it's not muted. If all else fails and you still cannot hear that video or your computer just does not have that capability, we are going to post the link to the video in the chat. We will send out the link to the videos in the webinar follow-up, and then there will be a summary in the chat as well so that you can read. And as you've probably noticed that after we come back from the video, we really do recap what the video is going over. So you'll have that opportunity to learn as well. So just give me a second to get that video going for you. Okay, so during the video, Dr. Carlson talked about how SARS-CoV-2, the virus that causes COVID-19, spreads from person to person. We learned that the main way SARS-CoV-2 spreads is through respiratory droplets. That's when somebody who is infected breathes out, coughs, or talks, and the tiny droplets in their breath are carrying virus particles. And then those are breathed in and can enter the eyes or nose of someone nearby or land on a surface, then are touched by someone else's hands and subsequently to their nose or mouth, which could potentially infect them. And so with that, I'm going to turn it over to my colleague Jenny Winkler, Director of Quality, Patient Safety, and Health Policy at IHA.
Thanks, Christina, for going through all of that with us. So in just a moment, we're going to spend a few more minutes talking about different modes of transmission and how viruses and other germs really can infect people. And so some different modes of transmission are outlined on this slide. And so we'll run through these real quickly. So the first one to start with is fomite transmission. And this occurs when an infection is spread to a susceptible person through direct contact with the surface of a fomite. And a fomite is a non-living object. So that's direct contact with something like a stethoscope, blood pressure cuff, or some other type of medical equipment that has been contaminated with infectious material. Another mode of transmission is contact transmission. And so this is when an infection can be spread by direct contact or touch from an infectious person to a susceptible person. And an example of that could be following an exam and then not doing hand hygiene. And some examples of infections that are transmitted this way include methicillin-resistant Staph aureus, or MRSA, or vancomycin-resistant Enterococcus, or VRE. So some different bugs that you might have heard about in your healthcare setting. A third mode of transmission is droplet transmission, which is what we've been talking a lot about. And that's when splashes or sprays occur from someone who might have an infectious disease. So when they cough, when they sneeze, that creates droplets, and those droplets are carried a short distance. So, and that short distance is usually somewhere within 6 feet. And so those germs can land in a susceptible person's eyes, nose, or mouth, and then cause some infection. And so again, as you've been hearing, as we've been talking, this is how COVID-19 is spread, but this is also how influenza or pertussis is spread as well. And then lastly, a mode of transmission that occurs is airborne transmission. And so germs can also be aerosolized in tiny particles in those respiratory droplets, and those can survive on air currents over great distances, so more than 6 feet, and then ultimately can be inhaled by a susceptible person. And so diseases that we hear that are usually, or that are spread through airborne transition that you might be familiar with, this is how tuberculosis is spread. This is how measles is spread as well. So we've looked at these photos before, but again, these are just really great reminders of why it's very important for us to block our respiratory droplets. So our breath isn't just air. It has a lot of water in it as well. And those respiratory droplets come out every time we talk, sing, cough, or breathe. And so most of the time they're so small we can't even see them, but they're there. And so this image helps us to remind this, or both of these images do. And so when someone is infected with SARS-CoV, the virus that causes COVID-19, the droplets that they breathe out have those particles in them. And those people that are close by within 6 feet can inhale those droplets, or those droplets can land on their eyes, their nose, or their mouth, and then cause them to get sick. And this happens even if we are not aware, if we have COVID-19. So understanding the spread of respiratory droplets is very important. Understanding how COVID-19 is spread and transmitted is really important, because that's what helps us to identify the different strategies that we can implement to prevent further spread of the virus. And so this slide outlines a handful of those different interventions with all of us in healthcare have encountered these throughout the pandemic. So, I'm sure you're very familiar with these. Of course, as it relates to COVID-19, the main way to prevent the spread of disease is by wearing that mask. And wearing a mask blocks respiratory droplets at the source, helping prevent the spread of COVID-19 to others. And then other than wearing our masks, some of those ways that we can prevent the spread of COVID-19 include social distancing. As we've learned, transmission of respiratory droplets most likely occurs in those close spaces, less than 6 feet apart. So if you've heard that 6 feet recommendation, that's where that comes from. Frequent hand hygiene is important. Washing your hands with soap and water for 20 seconds after being in public, after you blow your nose, sneezing, coughing before you eat or when you're preparing food, after using the restroom, after handling your mask or any PPE that you've been wearing or caring for someone who is sick, that hand hygiene is crucial. And then when soap and water aren't available, hand sanitizer works as well. Emphasizing the importance of respiratory etiquette with your colleagues, with staff, with patients is also important. And what respiratory etiquette is it includes covering your nose and your mouth with a tissue when you're coughing or sneezing, disposing of that tissue immediately after use, and then performing hand hygiene. So a lot of opportunities for us in healthcare to educate, our patients and their family members about respiratory etiquette. We also want to make sure we're improving ventilation. Spaces with poor ventilation increase the risk of coming into contact with those COVID-19 respiratory droplets. And we're going to talk a lot more about ventilation in one of our future series, but just something to highlight as well. And then lastly, for those where it is not a counterindication, getting and staying up to date with the COVID-19 vaccine is also important, as the vaccine's been proven to be effective at preventing severe illness with COVID-19, hospitalizations, and also death. Okay. So now that we've talked about, kind of the different mechanisms of spread for different diseases and how, some of the strategies related to COVID-19, we're going to go ahead and break into 4 different breakout rooms right now based on the different care settings that we work in. And we're going to talk through the questions that are listed on this slide. So we're going to talk about, some of those challenges and the hardest part about protecting ourselves against germs that can spread. And then also some of those strategies that we can use to keep germs from spreading. So each of our breakout rooms is going to have a Project Firstline team member serving as a moderator, and we'll have 15 minutes to discuss the questions listed on this slide. Again, our breakout rooms will be based on care settings, so we encourage you to join the group that is most closely related to the type of facility that you work in. And then at the end of the discussion, we'll come back and we'll share some of the highlights from our group's discussion around these questions. So keep in mind, again, we have a variety of healthcare providers with varying levels of infection prevention expertise in your breakout room. So we have the opportunity to learn a lot about strategies to prevent the spread of germs. So in a moment, you will see a pop-up window on the right-hand side of your screen that's going to allow you to join one of the breakout rooms. If that pop-up does not appear and you're in full screen mode, you'll need to hit Alt-Enter to take yourself out of full screen mode. You will hover over the menu bar at the top of your screen. You will select the option titled Breakout Sessions, and you'll be able to scroll down to the option where it says Join a Breakout Session, and then you can click on the breakout room that is most closely related to the care setting that you work in. So Christina will be on the line to help those if you're having trouble joining your breakout rooms, but we'll go ahead and we'll get those started now, and then we will come back together in 15 minutes. Thanks.
Okay, here we go. Okay, hopefully folks are able to see that menu bar. Again, exit Alt-Enter to exit your full screen. Menu bar at the top, you may need to click on Show Menu Bar and then navigate over to the breakout session. Now, yes, I see people putting in their chats into the chat. If you are unable to figure that out, you can go ahead and put your number that you would like to be assigned to in the chat. Now, know that that's going to take me a minute to manually do all that. So, if you could find it, that would be beneficial, but I will start working on assignments, okay? Okay, I believe I have gotten through all of my chat in my chat box with folks asking for room choices. However, I can still do that. So if I haven't, I see you, Mary Lou, I'll put you in number 1. So if you haven't been assigned yet and you need to be assigned to a room, go ahead and put your room number in the chat. I see quite a few of you still out there. Selena, where do you want to go? Put it in the chat. I might have missed it, and I'm sorry if I did. Got it. Okay, anyone else?
Hear me? This is Mel.
I hear you. Which room? I'm sorry.
My computer is froze, so what rooms are?
Oh, okay. So we've got room number 1, and you should be able to still hear sound. So we've got room number 1 is going to be our long-term acute care facilities. Number 4 is hospitals. Number 3 is
FQHCs.
Okay. Let me put you with outpatient. That's number 2. Okay.
Okay.
Those of you who have not yet joined a breakout session, I'm not going to force you into one, but if there's one that you would like to join, please let me know either through the chat, or you could also come off of mute and just let me know on the phone.
Okay. So it looks like everybody's jumping back here. Okay. So I'm sure that we had great amounts of discussion. I know our group had great discussion, and I hope that we all learned a lot. Those 15 minutes always go by so quickly. So we're just going to take a couple minutes now. We'll just highlight, what we discussed in each of the groups, and then we'll wrap up the rest of today's session. So I'll go ahead and start. Our group was the first group. Our group was the long-term care, assisted living facility, and home health folks. And so, some of the strategies that we talked about, of course, for preventing the spread of COVID, was the maintaining safe distancing between residents and staffs in the different facilities, ensuring that we're following PPE protocols and doing hand hygiene. Of course, some of the challenges to doing all of these best practices was fatigue. Everyone's fatigued after 2 years. Wearing PPE for those long periods of time is uncomfortable. Facilities are understaffed, and I think that's all across healthcare. It's not just one type of care setting. So I'm sure everybody is feeling that. Communication challenges, maybe some lack of understanding or some miscommunication with staff about the importance of wearing your PPE correctly. And then, of course, while COVID was on the forefront, making sure that we keep in mind that there are other multi-drug resistant organisms or other bugs out there. And so we want to keep those on the forefront to prevent the spread of those, even though COVID took up a lot of our focus for the last couple of years. So that's what our group talked about. So I'll go ahead and pause. And I think we will hear from, I think Val was next.
Right. I had the outpatient settings, and we talk about wearing a mask and keeping social distancing, cleaning after each patient. How another example was that they in the university they had masks everywhere, and then hand sanitizing station was very important, which is great. And also, again, scrubbing after the surface after each patient to prevent germ spread. That'll be it. I'll pass it to the next one.
Thanks, Val. That was great. Sharing what our outpatient folks are doing. So then Allison, I'll tag you.
Absolutely. So I had the group for local health departments and support organizations, and we had some great discussions with some different settings. So, we discussed basically one of the hardest parts about protecting ourselves from germs is that we don't exist in a vacuum. There are several other people around, so that can be some of the most difficult aspects of the work, I think, is we had a great example of actually how one of our CDCIs at the health department explains to the public is kind of think about taking a defensive driving course where you actually do have to be very aware of what everyone else is doing, especially when you're in transportation or in areas where you have a lot of people around, high risk settings. And then some possible strategies to keep germs from spreading. We discussed a lot of basic infection control, respiratory hygiene, distancing, source control, good PPE use, good hand hygiene. And we had some great examples from people who work a lot with children, especially where you want to make sure you're targeting your education to your audience. So we had a lot of great examples about like using songs kids already know to make sure they're appropriately washing their hands for the proper amount of time, and using like cute graphics where it's relatable characters wearing masks and stuff to make it just more accessible.
Great strategies. Wonderful. Thank you for sharing that, Allison. And then Kim.
So my group was the acute care hospitals, long-term care, and mental health facilities. So we talked about complacency and maintaining consistency, having a lot of registry staff or agency staff, and then them working in other facilities, coming in and out, not knowing what they're doing at the other facility, and trying to make sure that they're not picking up something at another facility and bringing it into their facility because they're working at multiple locations. Contact time and using the correct products and what surfaces should be cleaned. Making sure that the cleaning agent is being given the correct amount of time to dry. And then we also talked about, Dr. Bella had mentioned some for the proper, waiting for the proper air exchange times for the rooms. And I think we've seen that there is a lot of facilities, not, outpatient centers, things like that, that are struggling with waiting because they're trying to get the patients in the rooms and, turning over the rooms, especially in the outpatient facilities. So they're trying to turn the room over quicker and not waiting for the proper air exchange time to make sure that everything is, good for the next patient to come in before they come in. So, and just respiratory hygiene and signage on the room and helping the visitors and the families and the staff understand what the signs mean and why they should be wearing that the proper PPE.
Well, thank you so much for that, Kim. And air exchanges and ventilation and that type of source control is something we're going to talk about in our next session. So I'm glad that we've started that dialogue this week. That's wonderful. Okay, so just a couple last minute wrap up slides. We hope that you learned a lot today. Here's just some information about upcoming topic sessions that you'll see throughout this series, as well as some of the broader themes and topics that are covered with Project Firstline materials. There's a link to register for future webinars, and we encourage you, and you're welcome to pass those along to other colleagues in your organization. And so again, as you could see from today, a lot of the information is geared towards our frontline healthcare workers. So we definitely encourage you to share these webinar opportunities with those folks. We have Project Firstline resources. This slide highlights a bunch of different resources that are available on on the Project Firstline website, and it has information that you can find about the different videos and the different topics that we talked about today, as well as the Chicago Department of Public Health's Project Firstline website, where you can find additional information about healthcare associated infections. And then that is where the recordings for these this series will eventually be posted. So we do want to thank you for all of your time today and attending today's webinar. In the meantime, if you have questions, comments, or would like additional information on how you can partner with our Project Firstline team as a mentor or in other ways, please let us know. We encourage you to contact this infectionprevention@team.iha.org email address. And then again, before you sign off today, we ask that you complete the poll that's popped up on the right-hand side of your screen. The results from that poll are only seen by the presenters and not shared with other participants, but they are essential for helping us with plan out our future education sessions. So please complete that poll before you sign off today. For those that are seeking nursing continuing education credits, you're welcome to scan the QR code that pops up on the left-hand side of the screen on this slide and complete the information in the survey. If you're not able to complete that information at this time, again, a link will be sent to you following today's presentation. So thank you all. We appreciate everything you're doing, all of your efforts to keep your patients and your colleagues safe. So again, please complete the poll before you sign off today, but we hope you have a wonderful afternoon. So thank you all for your time.
Jenny. Thank you, everyone.